everybody. My name is Ralf Kiesslich, and I would like to show you something which is a new modality in GI endoscopy, which is a technique used with CellTolerance, which is endomicroscopy. So let me start with this gentleman. He has some symptoms related to food intake, and he seems to be quite unhappy. So what can he do normally to get a standard workup? He would go to a doctor for some IgE testing, which is a blood evaluation. He could do some prick testing or to do some breath tests to evaluate whether he has some problems which has to do with food allergy. And even if it's positive, you know that about 50 to 60% of all blood tests and skin prick tests will yield a false positive result. So here we have an uncertainty. But what is about those patients which have all negative results? We would do upper and lower endoscopy. If we reveal some macroscopic changes, this is a structural disease or an organic GI disorder. Mainly it's inflammatory bowel disease. Then we have a diagnosis which can be specifically treated. But if the upper and lower endoscopy is negative, we mainly call those symptoms irritable bowel syndrome. And as you know, this really affects the quality of life. We have no universal treatment pathway, and this is really a burden for the patient and also for the economy. And that's why we need to address those issues. There's a new possibility. And you see now, after negative upper and lower endoscopy, now the food sensitivity test could be an option. Here we apply some food onto the mucosa, and then we evaluate whether there's a positive or a negative reaction. If we see a positive reaction based on the food application, we call this a non-IgE mediated atypical food allergy, but gives us the option to recommend to those patients an exclusion diet. If our new test is negative, the patient still has the diagnosis of irritable bowel syndrome, and here symptomatic therapy is needed. So let's go to a real case. It's a patient journey, and that was a case for last week in my center here in Wiesbaden in Germany. That was a 53-year-old male patient who was quite skinny. He thought he has multiple allergies and intolerances since his childhood. He had an intense diagnostic workup and multiple endoscopies, but no macroscopic changes were found in upper and lower endoscopy. He also underwent IgE testing, which were negative, and prick testing. And so he decided to have a strict wheat diet since 12 years because he believed that the wheat is something which is very toxic for him. And he also believed that soy products are very good, and his main eating habits were based on soy products. So now this patient came to do the test to clarify mainly whether there's a wheat or a soy sensitivity. And patient had an IBS score from 380, which means he really is suffering from irritable bowel syndrome. So let's go into the procedure. Here you see the workup. You have the normal monitor where you see your endoscopic view, and right on the side you see your endomicroscopic monitor. I use high-def endoscope for upper endoscopy, and when I reach the duodenum, now the nurse is applying the fluorescein, which is 5 mils in a 10% concentration. Then I use the confocal probe, and here you see the blue laser light, which is emitted from the distal part. And now the probe is advanced over the working channel of the endoscope onto the duodenal mucosa. This is an important step to first have a view now on the microscopic architecture on the villi. This is the called long position of the endomicroscopic probe, but it's more recommended to have the short position at the 6 o'clock position, then you can get very stable images. And here we evaluated at the beginning how is the overall architecture of the villi within the duodenum. And here you see the simultaneous display on the left-hand side On the endomicroscopic images, and on the right, the video. Now again, these are the villi. We see the vessels with the red blood cells, but in between the villi, there's a dark appearance, so the lumen of the duodenum remains dark. Now we have the different allergens, which are applied now onto the mucosa. You see here, we started with wheat, and the wheat is now applied over the working channel of the endoscope. And then you have to wait for 2 to 3 minutes, and you start at the most distal part at the duodenum. After the waiting time, we again do some endomicroscopic imaging to see whether there's any reaction of the villi in the duodenum and whether we see any cell shedding or fluorescein leakage, which would be a positive result. But here you see very similar imaging to the first control. There was no reaction. So we go on with the next allergen, which is now soy. You see also here the soy is now again applied over the working channel of the endoscope. You go up a little bit higher in the duodenum, however you see it mix up a little bit. That's why you have to do your waiting time, again 2 to 3 minutes before you test whether there is any allergic reaction of the duodenal mucosa. Here I started a little bit earlier so you can see even the early changes of a positive reaction, because one of the early changes are edema and the swelling of the capillaries. You see here the dilated capillaries with a lot of fluorescein in the capillaries, but now all of a sudden you see that the fluorescein is leaking into the duodenum, and we also see a massive cell shedding, and the shed cells are seen as dark spots within the lumen of the duodenum. You can immediately check your results by going forward and backwards of your recorded video, and you see the cell shedding, you see the fluorescein leakage, and you see a lot of cells which are in the lumen, and this is a positive reaction. And so we have a clear diagnosis of this gentleman, because he made for 12 years a wrong diet. He really has an atypical food allergy against soy, but wheat can be tolerated, and that's why the new recommendation for this gentleman is soy exclusion diet, and wheat can be eaten. Here are some positive results of the procedure. Again, this is so important. Leakage and cell shedding. You see here the leakage on the top of the villus. A lot of fluorescein and cells are shed into the lumen. And you see here more cells coming up. Also here, many cells are shedding into the lumen. You see a clear, very bright area into the lumen. And you always can compare your brightness from the lumen compared to the villi. And this is a very bright signal. Also here you have massive cell shedding. And you will be surprised how massive and positive the reaction is if somebody has reaction. And then all of a sudden you look with your normal endoscope and you see that the villi and the mucosa still look completely normal. So the procedure really only works with an endomicroscopic imaging with CellVisio. And this is so important. You need your endomicroscopic view to clarify whether there is a positive reaction or whether there's a negative reaction. But what is the evidence behind? On 155 patients with IBS, they received the challenge with 5 common food components followed by confocal laser endomicroscopy. And to my surprise, and I think to the surprise of the whole scientific community, we saw that 50 to 60% of the IBS patients reacted in a sense of a non-classical food allergy. Moreover, and that was even striking, that 96 of the patients had an improvement of their symptoms when they had a tailored diet based on the results of endomicroscopy. And moreover, this positive result was very durable over 3 to 6 months, with more than 80% improvement of about 70% of the patients. I think endomicroscopy now has really a clear indication, which is an indication which no other technology can be achieved, because you can do functional imaging during ongoing endoscopy, and you can have a close look on the duodenal mucosa and see the reaction of the mucosa to different food allergens. We now have a very standardized and newly developed procedure, which is done by the gastroenterologist or the endoscopist, which allows immediate diagnosis of a typical food allergies. I'm personally absolutely convinced that the procedure has the potential to become an integral part of food allergy testing and should be mainly performed after endoscopic workup, IgE analysis, breath and prick testing. And by the examination, we have the possibility to offer our patients a tailored exclusion diet, which significantly improves quality of life by reducing abdominal symptoms.